Hello everyone, and welcome to the Better Sleep program, week number 2, problems sleeping and issues impacting sleep. The topics we're going to cover during this session are, first, I'm going to do a quick review of your sleep journal. I'm hoping that most of you were able to print and complete that activity last week. We're going to talk about common sleep problems, and as I mentioned in the introduction last week, there are more than 100 diagnosed sleep disorders, and we're going to cover some of the most common ones. And finally, I'm going to quickly review some additional resources for you to get more help and information if you suffer from one of these conditions that we're talking about. First, let's talk a little bit about the sleep journal. Hopefully, again, you were able to print that. It's very basic, very self-explanatory, but just to cover again some of the rationale or the reason I'm asking you to complete this is that sleep we've already discussed, and I hope you agree how important sleep is to us, but we can't take sleep for granted. We really have to put some effort into understanding our sleep habits and our sleep issues, and particularly if you are someone like many of us who is suffering with either quality or quantity of sleep these days. If we complete the journal, it makes all of this process and information less subjective. We actually have some numbers to look at, and by doing that, we can really help it can really help us to unlock some of the clues to why we aren't getting the sleep that we want. And finally, it's really important, I don't want you to get stressed out over the sleep journal. This is something that you should be able to complete very quickly and very easily. I don't want you to, in the middle of the night when you wake up, record it or anything like that. You can just rely on your memory in the morning to complete the journal in regards to what your activity was the night before. So the sleep journal shouldn't require that much effort. It's not something to get stressed out over, but I really recommend that you do it because I think you'll really find a difference in the understanding that you have around your particular relationship with sleep. So let's move on to really what we want to talk about this week. That is common sleep problems. So when we're talking about common sleep problems, we're really looking at quality of sleep, the timing of our sleep, and the amount of sleep that we get. And there are lots of different factors and issues that can impact that. The ones that I'm going to cover today are insomnia, which is very common, sleep apnea, snoring, restless leg syndrome, narcolepsy, and bruxism or teeth grinding. Now I'm really going to focus in mostly on the first three: insomnia, sleep apnea, and snoring, and then just touch basically on the other three. So let's talk about insomnia. First, it's very prevalent. About 1/3 of all Americans suffer from insomnia. And insomnia, the word actually comes from the Latin, and as you might guess, it means no sleep. And it's characterized by the following factors or issues. First, difficulty falling asleep, difficulty staying asleep, waking up too early, and having poor quality sleep, sleep that's not that restorative type of sleep that we talked about last week. And insomnia can be either primary or secondary. So primary insomnia means that it's the inability to sleep occurs by itself, and it's not caused by any other health condition, where comorbid or secondary insomnia occurs together with other health conditions that can interfere with sleep. And an example of that might be, if you're suffering, if you have a musculoskeletal injury, let's say that you've hurt your shoulder and you're sleeping on that shoulder, and you roll over and now you've got pain in the shoulder and it wakes you up and it can prevent you from getting restful sleep. That's secondary or comorbid insomnia, and that's a little bit more challenging because we have to address that issue as well. Insomnia can also be categorized by how long it lasts. Transient insomnia lasts for a few days, which again is very common for most of us. Short-term or acute may last for several weeks. Chronic insomnia, on the other hand, or long-term insomnia, lasts for a month or longer. Poor sleep or lifestyle habits that can cause insomnia or make it worse include things like going to bed at a different time each night, ineffective daytime napping, poor sleep environment, which we'll talk about next week, where there's too much noise or light, spending too much time in bed while you're awake, working evenings or night shifts, not getting enough exercise, or using the television or computer or other electronic devices in bed, which we've said, in the past just aren't a good idea. Some medicines and drugs can also affect sleep, and alcohol, of course, and other drugs, particularly alcohol if you are drinking prior to going to bed. Heavy smoking, too much caffeine throughout the day, or caffeine late in the day. Certain types of sleep medicines, and even cold medicines and diet pills and things, for example, can cause insomnia. The most common complaints or symptoms in people with insomnia include trouble falling asleep on most nights, feeling tired during the day or falling asleep during the day, not feeling refreshed when you wake up, or waking up several times during your sleep. And so that brings us to the treatment. So if you have insomnia, which again 1/3 of Americans do suffer from insomnia at some point, what is it you can do? Well, the first one is you're doing right now. You're participating in the Better Sleep program, which hopefully will increase your understanding of sleep and what you need to do to get a good night's sleep. So you've already taken the first step, participating in a program like this. There are some medications for insomnia over the counter and by prescription, and I'm not going to really touch too much on those. I think it's really beyond the scope of a program like this. What I would really suggest is that you talk with your physician or pharmacist about medications to really get their ideas, because that's something that's very individual for you. We talked a little bit before about melatonin. That's the hormone that regulates our sleep and awake cycles. Science has kind of been not conclusive about supplementing with melatonin, but some of the studies and things that I read said that it can make a positive impact on things like jet lag, or what they call delayed sleep phase disorder. And that's kind of when maybe if you're working shifts or something and your biological clock is a little bit out of whack, it seems that melatonin can make an impact on getting people to fall asleep quicker and easier. The one recommendation that I read, and again would suggest that you talk to your physician or pharmacist about this, that less is more when it comes to melatonin. So use a small amount and test and see how that works, as opposed to using the highest dose that you might be able to get. Another common problem is called sleep apnea, and it's also fairly prevalent. Roughly 18 million American adults have sleep apnea, 3 to 7% of adult men, and 2 to 5% of adult females in the U.S. suffer from sleep apnea. And sleep apnea is when you stop breathing for short periods of time while you're asleep. And you typically don't wake up when you're suffering from sleep apnea. You're not getting good restful sleep, but it's not, for most people, it's not enough to actually fully have them come awake. But in the morning you wake up, you feel exhausted, you're tired, you're sleepy all day. That's a sign of sleep apnea. And there's two types of sleep apnea. The first one is called obstructive sleep apnea, and that's the most common. And it happens when your throat muscles relax, blocking your airway. The other type is called central sleep apnea, and it's caused when your brain doesn't send the right signals to the muscles that control your breathing. And some people actually have a combination of both of those. That's called complex sleep apnea. But the most common, again, is the obstructive sleep apnea. And some of the signs and symptoms of this include loud, irregular snoring, and then quiet periods of at least 10 seconds when your breathing actually stops. And these episodes can happen up to 100 times each hour. So that's really amazing when you think of it. Then you stop breathing for 10 seconds and then you loud, abrupt, irregular snoring. Again, that's a telltale sign of sleep apnea. Daytime sleepiness, as I mentioned, feeling depressed, moody, or irritable, not being able to concentrate or remember things are a sign of sleep apnea. It's linked to being overweight, having large tonsils and adenoids, high blood pressure, smoking. I mentioned alcohol use, especially for bedtime. Drugs like sleeping pills or heart medications, all of these are linked to sleep apnea. The typical person with sleep apnea is overweight, typically middle-aged, and as we said, males, it's more common in males than females, and it can be hereditary as well. And now, as far as treatment is concerned, that depends on several factors. What's blocking your airway in obstructive sleep apnea, how severe the sleep apnea is, and other medical conditions that you might have. And so that's where, if you think that you are suffering from sleep apnea, this is one of those cases where it's good to talk to a specialist, a sleep doctor, about it and get further studies about what's the best treatment for you. The most common is something that I think most of us are probably familiar with. It's called the CPAP, or Continuous Positive Airway Pressure Machine. And that's a device, kind of a mask that fits over your face, and you sleep with it, and it really kind of forces the airflow while you're sleeping to avoid that sleep apnea. Lifestyle changes can also help, and so as we said, in regards to kind of the causes or things that can be associated with it, if you lose weight, limiting your alcohol, antihistamines and tranquilizers, things of that nature. Even gargling with salt water, for example, will help to shrink your tonsils, and that can make an impact on sleep apnea. Sleeping on your side rather than your back, elevating your upper body from the waist up seems to make a difference with being able to breathe easier. Using an air humidifier at night so the air is moist. So there's a number of different things that you can try. Snoring. Okay, so you've probably heard the saying before, laugh and the whole world laughs with you, snore and you sleep alone. Snoring is one of those things that I'm guessing that all of us do it at some point. But as far as prevalences are concerned, and I'm sorry about this, guys, but we tend to snore more than women. 9% of females, about 30% of males. I think we all know what snoring is, that loud, hoarse, kind of harsh breathing that occurs while we're sleeping. Causes for snoring. When you sleep, the muscles in your throat relax and your tongue slips back in your mouth a little bit. And so snoring occurs when there's some blockage of the airflow back there freely through your mouth and nose. So that's kind of the cause of it. Some of the factors that can lead to snoring include being overweight, tissue swelling, in the back of your throat or tongue, what they call a deviated septum or crooked or bent nasal septum. That's the bone or cartilage that's in between your nostrils. Having a stuffy nose from a cold or allergies, swollen adenoids or tonsils, all of these things can cause snoring. So how do you reduce snoring? Now there's lots of different devices that you see advertised on TV, magazines, radio, and so forth. So there's a lot of those that are out there. Some of the things that in my research that kind of made sense to me: one, avoid alcohol and medicines that make you sleepy at bedtime. Don't sleep on your flat on your back, so try to sleep on your side instead. If you're overweight, losing weight can make a difference. One of the over-the-counter things that seem to really help are the drug-free nasal strips that widen your nostrils. And this, by the way, is not a treatment for sleep apnea. This is just for snoring, but doing something that helps increase the airflow. And if you need to, breathing devices and things like that, are other things that you can try. So I'm going to touch just briefly on the other three common issues that I mentioned: restless leg syndrome, narcolepsy, and teeth grinding. Restless leg syndrome, as far as how common it is, it's about 10% of the population. It's actually more common in women than men. Experts aren't exactly sure what causes restless leg syndrome, but there is some theory that it's hereditary. Some medications have also been known to cause restless leg syndrome, and sometimes pregnant women suffer from it more while they're pregnant and expecting than other times. And the symptoms are this kind of irresistible urge to move your muscles, not only your legs, but typically your legs. It occurs in the evening and during periods of rest. And as far as treatment is concerned, the first thing to try is getting regular exercise, reducing caffeine and alcohol. And if you have a severe case, again, talk with your physician about that. There are some medications available. Narcolepsy is another common sleep problem that we deal with, and that's caused by easy for me to say, abnormalities in the parts of your brain that control our REM sleep. And you remember from last time, REM sleep stands for rapid eye movement, and that's the deep part of sleep where we dream and help to get that restorative effect of sleep. It's less common. About 200,000 adults are diagnosed per year with narcolepsy, and the symptoms of it are suddenly falling asleep, and it can happen really at the most inopportune moments. You can be in the middle of the day and find yourself falling asleep. There's kind of a differentiation between being wide awake and sleeping, and someone may appear to, you're having a conversation with them, and they at first may appear awake, but then they're actually like nodding off and falling asleep. So narcolepsy is one of these conditions that not very common, but something that you should really explore, and I have some resources for you at the end that we'll talk about. Bruxism or teeth grinding is another common factor, and about 45 million Americans suffer from that. And as far as the cause is concerned, most experts blame excessive stress and anxiety. And the symptoms can be headaches or a sore jaw when awakening in the morning, and there can be dental issues and so forth. As far as treatment is concerned, avoid chewing any items that aren't food, as it trains the jaw to clench. So gum chewing and things like that aren't a good idea if you suffer from that condition. And most people that do suffer from bruxism end up getting fitted with a mouth guard that can be provided by a dentist, and that helps protect your teeth and jaw at night. So those were the common kind of conditions that really make an impact on us getting good quality sleep, restorative sleep, being able to fall asleep efficiently and effectively, staying asleep, and length and quality. All of those conditions can impact that. In a program like this, we can't get into too much detail about any one of those, so I've supplied here a list of resources if you do suffer from one of these conditions to get a little more information and some resources that you can explore. So there's the American Sleep Apnea Association, for example. There's the Narcolepsy Network, Restless Leg Syndrome Foundation, the National Center on Sleep Disorders Research, the National Sleep Foundation is another good source of these. So there's the good news is that if you suffer from any of those conditions, you're not alone. As we mentioned, snoring is very, very common, as is generally having a difficulty, falling asleep or staying asleep. But even in the ones that aren't so common, there's help available. There's resources available for you. So to wrap this up, and I apologize, this session is a little bit longer, but there's so much to cover here. I want you to please review your sleep journal at the end of the week and keep that process going and see if you notice any trends or any connections with maybe what you ate that day or the amount of exercise that you got and the quality of sleep that you're getting. Remember that we've put together the Better Sleep library of information, and I'd like you to review that, where I have articles on these different topics where you can dig a little deeper. And finally, you'll try this tip for better sleep, and this one's in regard to snoring. It's a simple one. If you normally sleep on your back, which many people do, try shifting and sleeping on your side. It seems to help with snoring. As always, I thank you for your time and attention, and wish you a really restful, sleep like a baby night, and look forward to talking with you again next week.